Improving healthcare in mainland China attracts Hong Kong residents to travel north for medical treatment. After the comprehensive clearance of Hong Kong and mainland China, Hong Kong people are enthusiastic about going north for consumption. In addition to eating, drinking, and playing, many people also go to the mainland to seek medical treatment. Even if they cannot enjoy mainland medical insurance, they are still willing to choose to go to a tertiary hospital in mainland China and fully self-pay for the treatment of severe illnesses such as cancer. Although cross-border medical treatment may sound troublesome, according to experienced Hong Kong people, the efficiency of seeking medical treatment in Shenzhen is much higher than in Hong Kong. Recently, a Hong Kong mother took her daughter to the hospital in Shenzhen for surgery, and it took her 3 days from start to finish. I can't even imagine this efficiency in Hong Kong. Why sacrifice the near for the far? This Hong Kong mother's daughter has a sensitive nose and finds it difficult to fall asleep. But Hong Kong mothers inquired and found out, public hospitals in Hong Kong can queue for over a year at the earliest, unless the situation is too serious. So after careful consideration, Hong Kong mothers decided to seek distance from the near, and chose a tertiary hospital in Shenzhen for medical treatment. Unexpectedly, the efficiency of Shenzhen hospitals is surprisingly high. Not only is the treatment queue time short, but medication and surgery are also arranged very closely. Admission on the first day, surgery on the second day, and return to Hong Kong on the third day. Mr. Luo, who is 65 years old this year, felt unwell in 2019 and sought medical attention in Hong Kong. The doctor arranged for him to undergo a physical examination, but the schedule was long, taking 3 months. Many friends suggest that he should not procrastinate and instead go to the mainland to see. On the recommendation of his relatives, Mr. Luo sought medical treatment at a tertiary hospital in Guangdong Province and Dongguan People's Hospital. The doctor arranged for him to undergo a physical examination, including blood tests and computed tomography (CT) scans. Within 3 days, the results showed that he had rectal cancer. Just as Mr. Luo felt lost, his relatives in Dongguan said that the medical level of mainland hospitals was good, and there was a cancer expert stationed there, so he chose to stay in mainland China for treatment. For the next 4 years, Mr. Luo stayed in Dongguan for 3 years, undergoing surgery and chemotherapy, and ultimately defeated cancer. He said that over the course of 4 years, the treatment cost amounted to 470,000 renminbi, approximately 502,000 Hong Kong dollars. During the same period, one of his friends also suffered from rectal cancer and stayed in Hong Kong for treatment. Although he was cured, it cost 2.1 million Hong Kong dollars. According to reports, mainland residents who purchase medical insurance will receive about 40% to 50% of medical expenses from the government once they seek treatment for illness. Mr. Luo, as a Hong Kong resident, went north to seek medical treatment and did not have mainland medical insurance. He had to pay the full amount, but he still felt that the money was worth it when he recovered his health. The Hong Kong Special Administrative Region government announced on February 19 this year that 7 medical institutions located in core cities of the Guangdong Hong Kong Macau Greater Bay Area will be included in the Elderly Medical Voucher Greater Bay Area pilot plan, allowing eligible Hong Kong seniors, elderly, to have more service options when using medical vouchers in the Greater Bay Area. The pilot program will be launched gradually from the third quarter of 2024. The pilot plan includes 5 comprehensive medical service institutions and 2 dental medical institutions. Among them, there are 5 new comprehensive hospitals among the newly added medical institutions, including the first affiliated hospital of Sun Yat-sen University in Guangzhou, the Nansha campus of the first affiliated hospital of Sun Yat-sen University, as well as the Zhongshan Qinghai Integrated Traditional Chinese and Western Medicine Hospital in Zhongshan, Dongguan Donghua Medical Hospital in Dongguan, and Shenzhen Xinfeng Hemujia Hospital in Shenzhen. Nearly 1.7 million elderly people in Hong Kong benefit from this. Prior to this, in Hong Kong, the elderly were able to access public medical services at a lower cost. However, this comes at the cost of long queues and waiting. According to data from the Hong Kong Social Welfare Department, over 30,000 people are waiting for government-funded nursing home beds, with an average waiting time of 2 years. According to data released by the Medical Authority at the end of December last year, there are currently 18 public hospitals in Hong Kong, and 10 of them have emergency queue times exceeding 8 hours. The general process of seeking medical treatment in Hong Kong is as follows: general clinic, specialist clinic, examination, whether surgery is necessary. Specialized outpatient clinics are a triage system, divided into emergency, semi-emergency, and stable. Patients who are classified as urgent or semi-urgent will be arranged by medical staff to seek medical treatment within 2 or 8 weeks as much as possible. It's hard to say about stable patients. In Hong Kong, private medical institutions provide more efficient medical services, but they are more expensive. Many elderly people in Hong Kong are unable to bear this burden. Therefore, in order to enable the elderly to choose private primary healthcare services that are more suitable for their health needs, and reduce the burden on the elderly in using private primary healthcare services, the Hong Kong SAR government initially launched the Elderly Medical Voucher Scheme in 2009. According to the Hong Kong Special Administrative Region government, the plan now supports a medical voucher of 2,000 Hong Kong dollars per year for each eligible Hong Kong elderly person aged 65 and above. The unused amount of medical vouchers each year can also be accumulated for use in subsequent years, with a maximum cumulative limit of 8,000 yuan. In addition, couples are still sharing medical vouchers within the scope of compliance with regulations. If the spouse passes away, they cannot be used again. However, this still cannot solve the problem of Hong Kong's local social resources being unable to meet the growing pressure of aging. In this context, more and more elderly people in Hong Kong are choosing to leave Hong Kong and head north for retirement. According to the Statistics Department of the Hong Kong Special Administrative Region government, as of the end of 2022, approximately 965 Hong Kong residents aged 65 and above are living in Guangdong. Another demand has emerged for Hong Kong seniors to go north for retirement. This is because Hong Kong elderly cannot enjoy medical insurance reimbursement benefits when seeking medical treatment in mainland China, and they hope to bring the benefits enjoyed in Hong Kong to the mainland. To this end, in order to provide greater convenience and flexibility for eligible Hong Kong elderly, the Hong Kong SAR government extended the elderly medical voucher to the mainland for the first time in 2015. However, at that time, the scope of implementation of the plan was limited to Hong Kong-funded hospitals located in Shenzhen. At that time, the Hong Kong SAR government launched a pilot program that allowed eligible Hong Kong seniors to use medical vouchers to pay for outpatient medical care services provided by designated departments of the University of Hong Kong Shenzhen Hospital. As demand continues to expand, the scope of the implementation of the elderly coupon program is also being adjusted in a timely manner. The Hong Kong SAR government's pilot plan also aims to achieve full coverage of core cities in the Greater Bay Area to care for the elderly in Guangdong. In the 2023 policy address of the Chief Executive of the Hong Kong Special Administrative Region, it was explicitly stated that the Elderly Medical Voucher Greater Bay Area pilot plan will be launched, and in 2024, the scope of application of the Elderly Medical Voucher will be expanded to suitable medical institutions in the Greater Bay Area. Some Hong Kong people have already experienced it. The examination cost 1,600 yuan, and the medical insurance directly reimbursed 1,280 yuan. Hong Kong people can pay an additional 320 yuan at their own expense. At present, if everyone's condition cannot be delayed for too long, and wants to seek medical treatment quickly, going north for medical treatment is actually a good choice.